Bombay. Once again, ma'am, I warm welcome you in our today's session. And we all salute your work. Indeed, you are doing a great job, ma'am. Now I request Dr. Anita, ma'am, to hand over this session. Over to you, ma'am.
I'm just preparing to share the presentation. My team is helping me.
Okay. Once again, ma'am,
Yes,
I want you in our today's session. And we all salute your work. Indeed, you are doing a great job, ma'am. Now I request.
Late हो गया. Can you send them the PPT? Sachin, excuse me, can you give permission to ISSP Tara email at gmail.com to present? ISSP Tara at
Yes,
gmail.
ma'am. Ma'am, can you please ask them to join again?
Please join again. ISSP Tara at gmail.com is my institute's official email ID. Please accept them so that they can help me to present. Can you hear me?
Yes, ma'am, yes.
Okay. Well, by the time they start, I think I can begin. I suppose this presentation is for all the NSS students of St. John's College. Am I right, Sachin? Hello? Hello?
Yes, ma'am, yes.
I do not know how many participants are here, whether they are, I suppose they are all tuned in to this. As I was introduced, and on this occasion of HIV, World HIV AIDS Day, I want to begin by asking, first of all, when we hear this word HIV AIDS, what are the different words that emerge in our mind? Can some participants just unmute and just shoot out whatever words come to your mind when you hear the word HIV AIDS? Anyone?
It's a taboo
Come
in
on.
India.
Pardon?
It's considered to be a taboo in India.
Yes, very good. Okay. A taboo in India. Any other responses?
Contagious.
Contagious, I heard from someone. Yes. Anyone?
Ma'am, we heard an unprotected sex or an transmission of blood.
Okay, something like you are saying transmission of blood, unprotected sex. Yes. Anything else? Okay. Someone said about taboo, a taboo in India. No, why? Why you think it is a taboo? Is Corona a taboo? Now we are talking so much about Corona, COVID. Is that also a taboo? Come on. Give your opinion.
HIV AIDS is considered to be a taboo in India because it is known to be spread via ways or methods which are unethical, not accepted by the society largely.
Okay. Unethical. Because we associate it only with sexual transmission. So, well, in this presentation today, I would like to present the basic facts about HIV/AIDS and also the various myths and how do we help people who are affected. I'm sure many of you participating in this webinar already know what is HIV/AIDS, how it is spread, I suppose. But just to uh, refresh our memories, our knowledge, I would like to run through a brief presentation, the PPT, as to what is HIV, what is AIDS, what is the difference, is it same, what is the difference between HIV and AIDS, and what are the different modes of transmission. I'll just check with my team whether the PPT is ready. 1 minute.
Ma'am, can you tell us please your email address to accept you? Ma'am, can you please repeat your mail address, Gmail address? Ma'am, you are unmute.
We are not getting entry.
Yeah,
ISSP Tara. Did you get it? ISSP Tara is requesting to join.
Okay, okay. Okay, okay.
ISSP Tara is requesting entry. Just accept.
Yeah, yeah. Saurabh, can you please check this?
Yes, ma'am, I have sent invite to them.
Join now. Yeah.
Okay.
Okay. Yes, I think now.
Right, please.
Yes, thank you.
Yeah.
Yeah, I think we are seeing quite many faces who are active. Okay, yeah. Can you see the first slide?
Yes, ma'am.
Yeah. Okay. Well, welcome to the World AIDS Day. You call it celebration, you call it commemoration. First of all, I want to say this day is celebrated. First of all, we want to thank all the doctors and scientists who have been working so many years to get they have not succeeded a cure, but definitely they have succeeded in the ART therapy, which is helping many AIDS patients today to live lives longer and healthier lives. So we want to celebrate their success. That is one reason. Secondly, we want to remember all our friends who have succumbed to this disease. So we just pause a half a minute in silence, remembering those who have succumbed to this disease, either because they did not get the necessary medication in time, or because they were neglected, discriminated, rejected, and they died not just because of the disease, but because of isolation and neglect. So we just remember them, we pray for their souls to rest in peace, and we also pray for their family members who have lost them. Especially children have lost their parents who were infected by AIDS, and they are now orphans. So we pause for them and send positive vibrations to these children especially. Okay, thank you very much. We now move on. World AIDS Day, every year, they bring up a theme for us to reflect. World AIDS Day as such began in 1988. And this year, the theme they have chosen is the World Health Organization, UNAIDS, they've come together and chosen this theme, ending the HIV epidemic, ending resilience and impact. Resilience and impact. What it is, we'll just understand ahead. Next. as I already did this before we started this technical, what thoughts emerge? You said taboo and sexual transmission and all that. I move ahead. Why we talk of HIV/AIDS? First is because it affects people mostly in the productive age group of 15 to 40 years. The young age group is affected. And there is no cure for AIDS. Stigma is attached in the society. For all these reasons, we have to talk about HIV/AIDS more and more, because it is not just a medical problem you will see now. And anyone can be infected by it. Just briefly, some statistics. I was thinking of comparing COVID-19 and HIV/AIDS. Which one is more serious, more alarming? HIV has lived for so many years now. How many years? 20, 30 years. We are grappling with this disease, and still there is no vaccine, no treatment, no cure. COVID, the whole world is working on it right now. As of today, I just want to focus on the second figure. 1,700,000 people were newly affected in 2019. If you see, it's easy to understand. 17 lakhs, 1,000,007 lakhs people were infected by HIV just in 2019. COVID, actually, if you see the global figure, it's just 1,500,000 people, a little less than HIV. Whatever it is, corona people easily accept, but when we say someone is HIV positive, oh my God, how terrible. And in India also we see, in 2009, you will wonder why I'm giving you the figure of 2017. Unfortunately, this is the state of India. Since recently, many efforts to work on HIV has been stalled. The funds that were meant for HIV and AIDS are siphoned off for other purposes. So today, so many NGOs that were working on community-based support and care are closed down because the funds are not there. They feel HIV, oh, what is there to work for? And so today, this figure I took from UNAIDS website. UNAIDS also has data of 2017 for India. Why is India not giving them the data for 2019, 20? This used to happen earlier, before 17. Every year, 1st December, just little before 1st December, we would get the stats of that year. But today we are not getting it. Why? Because for India, HIV is not an issue, unfortunately. Next. This is a small video which has been prepared by WHO on this year's AIDS, HIV/AIDS. Just we'll view it. It is just 1 minute and 20 seconds. I hope you can see it and listen to it. Play the video, please. Yeah. Yes, just volume. Can you hear? Volume. Just a minute. Okay, maybe I'll show the video later. I'll proceed with my presentation. Go ahead. There's some technical difficulty. Okay.
HIV/AIDS is far from over. During the COVID-19
Yeah.
pandemic, there are signs the HIV epidemic may be accelerating in countries. This is largely due to a breakdown in essential HIV services, especially HIV prevention and testing services, and fewer newly diagnosed people starting HIV treatment. If we do not pick up the pace for preventing new infections and finding and treating those with HIV, we will miss our 2030 goals. That's why the WHO is calling on global leaders and citizens to rally for global solidarity to maintain essential HIV services during COVID-19 and beyond. By finding innovative ways to safely deliver person-centered HIV prevention, testing, treatment, and care services. By ensuring that all groups of people at risk continue to obtain the services they need. By protecting, engaging, and supporting the nurses, midwives, and community health workers working on the front line of HIV and COVID-19. By renewing our fight to end AIDS. Let's work together to halt COVID-19 and get back on track to end AIDS by 2030.
Sorry, my mic was off. Sorry. The WHO is calling on global leaders and citizens to rally for global solidarity to overcome the challenges posed by COVID-19 on the HIV response. We need to see the connection between COVID and HIV. Next, as we saw in the video, today, normally, even an ordinary citizen who wants to go for medical care in COVID pandemic times, it's so very difficult. They are not cared for unless very serious symptoms. I know of a patient who wanted to go for high fever and some other complication. She went to the dispensary and the doctor said, please sit far. I cannot take your BP, I cannot take your temperature. Just tell me what is your problem, I'll give you the medicines. If this is the state of ordinary citizens having with simple problems, we can imagine what is the state of people with HIV/AIDS. Those who are supposed to, those who usually go to government centers, most of them go to government centers for their ART treatment. In COVID times, are the government hospitals open enough? At least right now in these few days, it is things are better. But in the last few months, it was really very, very hard for HIV/AIDS people to get their treatment. Let us see why it is so important for them, their medication. By the way, before that, what is HIV? HIV is what? Human immunodeficiency virus. It's the virus. And this virus can only infect human beings. Remember, this virus can infect only human beings. It lives only in human beings. Outside the human beings, it dies. It cannot live. Unlike corona. Immuno means immunodeficiency. It survives on immune cells of the body, creates a deficiency within the body's immune system. Like in Hindi, I was requested to speak in Hindi also. Immunity यानी कि रोग प्रतिकार शक्ति, HIV वो विषाणु है जो मानव शरीर के अंदर जाता है और मानव का जो रोग प्रतिकार शक्ति है उसको दुर्बल करता है और उसको धीरे धीरे वो बढ़ता है और उसको नष्ट कर देता है रोग प्रतिकार शक्ति को। तो जब हमारा रोग प्रतिकार शक्ति नष्ट हो जाता है तो हमारे शरीर में कोई भी जो बीमारी आ जाती है हम उसका शिकार हो जाते हैं। तो वो भले सर्दी हो, बुखार हो, टीबी हो, कोई भी बीमारी, जब बीमारी के जो जंतु, वायरस या बैक्टीरिया हमारे अंदर आ जाता है, हमारी रोग प्रतिकार शक्ति उससे लड़ाई नहीं कर सकता। ये रोग प्रतिकार शक्ति जो है वो हमारे देश के सैनिकों के जैसे हैं। कैसे सैनिक दुश्मनों का सामना करते हैं, उनको नष्ट करते हैं, उनको आने नहीं देते, उसी तरह ये रोग प्रतिकार शक्ति हमारे शरीर में होते हैं। अगर ये रोग प्रतिकार शक्ति ही हमारा नष्ट हो जाएगा तो हम कुछ नहीं कर सकते। तो ये है बड़ी समस्या HIV एड्स में। हाँ, तो HIV ये जो है वायरस है। ओके, वो जो छोटा सा है वो वायरस है जो कि इलेक्ट्रॉन माइक्रोस्कोप में ही देख सकते हैं। और ये वायरस ऐसा है कि शरीर में भीतर जाते ही वो इंक्रीज होने लगता है, बढ़ता है। और तो फिर एड्स क्या है? अगर HIV ये वायरस है तो एड्स क्या है? मैंने मिनट ऑलरेडी समझा दिया है। ओके, और ये जो वायरस है सिर्फ मैंने बताया ह्यूमन ब्लड में ही होता है और ह्यूमन फ्लूइड्स में होता है। ह्यूमन फ्लूइड्स कौन से होते हैं वो हम देखेंगे। हाँ, उसके पहले जस्ट मैं बता देती हूँ एड्स का अर्थ क्या है। एड्स का फुल फॉर्म है एक्वायर्ड इम्यून डेफिशिएंसी सिंड्रोम। एक्वायर्ड मतलब पाना, वो बाहर से मेरे भीतर आया है, अंदर से अंदर मेरे उत्पादन नहीं हुआ है, अपने आप नहीं आ सकता है। कोई HIV अपने आप बाधित नहीं हो सकता है। कैसे वो अक्वायर करते हैं, अभी कैसे अक्वायर होता है वो हम देखेंगे थोड़ी देर में। तो वो ट्रांसमिट होता है पर्सन टू पर्सन, नॉट फ्रॉम एनिमल टू पर्सन, not from mosquitoes to person, from human person to human person HIV का एंट्रेंस होता है शरीर में। इम्यून, वही मैंने कहा ऑलरेडी, वो अपनी रोग प्रतिकार शक्ति को बर्बाद करता है और उसको कमी करता है। और सिंड्रोम यानी कि एक ग्रुप ऑफ सिम्टम्स, जब किसी को ऑलरेडी बहुत सारे सिम्टम्स शरीर में आ गए, लाइक सर्दी है, खांसी है, जुलाब हो गया है, TB है, ये सब बीमारी जब एक साथ आक्रमण करता है शरीर को, जिसके शरीर में HIV है, उस व्यक्ति को हम कहते हैं कि ये एड्स बाधित है। वो लास्ट स्टेज होता है HIV का, जब वो बढ़ जाता है और ये सब रोग उसको आक्रमण करते हैं। तो क्या किया जाए? और ये HIV अपने शरीर में आता कैसा है? हमने देखा है कि वो ब्लड में होता है, ह्यूमन ब्लड में, और फ्लूइड्स। ह्यूमन ब्लड और फ्लूइड्स किस तरह से ट्रांसमिशन होते हैं? एक तो किसी ने ऑलरेडी शुरुआत में कहा, अनप्रोटेक्टेड सेक्सुअल इंटरकोर्स विद इन्फेक्टेड पर्सन। अगर समझो किसी व्यक्ति के शरीर में ऑलरेडी HIV है और कोई भी उस व्यक्ति के साथ अगर लैंगिक संभोग करें तो उनके शरीर में भी ये विषाणु आ सकता है। और तो इसलिए अनप्रोटेक्टेड क्यों बोलते हैं? अगर ये इन्फेक्टेड पर्सन ने समझो प्रोटेक्शन का वापर किया है, जैसे कि कॉन्डोम, और उसने लैंगिक संभोग किया है, इंटरकोर्स करते हैं, तो prevention in transmission is very minimum. But there also, why I say minimum, not absolutely, you cannot say it's impossible, because sometimes the kind of way the people use the condom, the quality of the condom, all that also factors are there. But however, it spreads through unprotected sexual intercourse with infected persons. Receiving blood transfusion, blood which is infected by HIV positive blood. So receiving, suppose किसी का एक्सीडेंट हो गया, अचानक उनको हॉस्पिटल लेके गए और वो उसको रक्त की जरूरत पड़ी और वो खून को टेस्ट नहीं किया था और टेस्ट किए बिना ही किसी को दे दिया, और अगर वो खून में HIV के विषाणु है तो जो इंसान खून लेता है उसको भी HIV हो जाता है। और एक है जो HIV पॉजिटिव माता है, वो अपने बच्चे को HIV विषाणु ट्रांसमिट कर सकती है। कब? प्रेगनेंसी में, चाइल्ड बर्थ में, या ब्रेस्ट फीडिंग के दौरान। तो इसलिए हम देखते हैं कि बहुत सारे बच्चों को भी HIV पॉजिटिव हो जाते हैं। शुरुआत में किसी ने कहा अनप्रोटेक्टेड सेक्स, उसके लिए वो टाबू है। ये बच्चों का क्या करें हम? बच्चे, जब मैं चिराग में काम करती थी HIV एड्स लोगों के साथ, वहां पे बच्चे भी आते थे अपने माँ बाप के साथ, और बच्चे जो ऑलरेडी बाधित हो गए थे वो हमें पूछते थे, मैडम मुझे ये दवा कब तक लेना पड़ेगा, मैं क्यों लूं, मेरी क्या बीमारी है। हम क्या समझाएं इनको। कभी कभी तो बच्चे जो समझ जाते हैं बोलते कि मेरे माँ बाप की वजह से मुझे हुआ है, तो बच्चे पूछते मैडम हमारी क्या गलती है इसमें, तो क्या मुझे कितना देर तक लेना पड़ेगा। बहुत मुश्किल होता है कहने के लिए कि ये जिंदगी भर लेना पड़ेगा ये दवा, और वो बहुत निराश होते हैं। तो हमारा काम बनता है उनका हौसला बढ़ाना। उनकी गलती नहीं है, किसी की गलती नहीं है। ओके, नेक्स्ट। हमें सावध रहना है, संभाल कर रहना है। जानकारी, नॉलेज इज पावर। पूरी तरह सही तरह से सही इंफॉर्मेशन जानना बहुत जरूरी है। इसलिए 1 दिसंबर को हम इसलिए HIV एड्स खास मनाते हैं, क्योंकि हम चाहते हैं कि सभी लोगों को इसके बारे में सही जानकारी होनी चाहिए। और एक पद्धति है जो ट्रांसमिशन, मोड ऑफ ट्रांसमिशन है, शेयरिंग और यूजिंग इन्फेक्टेड नीडल्स, ब्लेड्स एंड सिरिंजेस। ये हम देखते हैं अक्सर, विशेष करके कभी कभी जो ड्रग एडिक्ट्स होते हैं ना, आपने देखा होगा, एक सिरिंज में वो ड्रग्स ले लेते हैं और उनके दोस्त के साथ वो शेयर करते हैं। हाँ, एक दोस्त बोलता है अरे यार मुझे भी एक देना, तो बोलता है मुझे भी एक मुझे भी दे देना। तो उन लोग एक ही सिरिंज से वो ड्रग्स लेते हैं, तो उसमें भी उनका ब्लड ट्रांसफ्यूजन होता है वहां पे, तो वो उस माध्यम से भी HIV स्प्रेड हो सकता है ना। HIV एड्स कैसे स्प्रेड होता है तो हमें पता है, इजी है जानने में, लेकिन अक्सर क्या होता है हम लोग डर जाते हैं अननेसेसरीली। तो हमें जानने की जरूरत है कि HIV एड्स कैसे नहीं फैलता है, अभी वो जानना भी बहुत जरूरी है। किसी के हाथ मिलाने से HIV नहीं फैलता, किसिंग हगिंग करने से HIV नहीं फैलता, सेम टॉयलेट्स यूज करने से HIV नहीं फैलता, क्योंकि आप देखोगे कि ये सब कार्य करते समय हमारा खून तो आपस में ट्रांसमिट नहीं होता, बॉडी फ्लूइड्स ट्रांसमिट नहीं होता, तो HIV कैसे फैलेगा। सिमिलरली टॉयलेट शेयरिंग करने से, समझो एक व्यक्ति ने जिसको HIV पॉजिटिव है उसने टॉयलेट यूज किया और मैं बाद में जाके वह टॉयलेट यूज कर सकती हूँ क्या? जरूर, क्यों नहीं। यहाँ पे कोई फ्लूइड्स का या ब्लड का तो ट्रांसमिशन होने की चांसेस ही नहीं है। वैसे ही स्विमिंग पूल, HIV वायरस स्विमिंग पूल में नहीं रहता, वो मच्छी नहीं है जो तैरता है पानी में। वैसे ही शेयरिंग फूड, शेयरिंग ऑफ बेड, लिनेन, टॉवल से इंफेक्शन नहीं होता है। नेक्स्ट। और इंपॉर्टेंट बात है, लिविंग in the same house, working together, socializing with people who are infected, no one will get HIV. No one will get the infection. Let's keep this in mind. Also, through coughing, sneezing, mosquito bite, hugging one another, kissing, handshake, उसे HIV नहीं फैलता। सो अगर इन सब बातों से HIV नहीं फैलता तो हमें डर किस बात की? डरना नहीं है। लोग HIV बाधित व्यक्तियों के साथ बात करना, मिलना, रहना कोई प्रॉब्लम ही नहीं है, लेकिन खामखा हम लोग हमेशा एक मिथ, जो मिसअंडरस्टैंडिंग में रहते हैं, अरे वो मेरे घर में रहेगी, HIV हो गया उसको, मेरे घर पे रहेगा तो हम सबको हो जाएगा। इसके वजह से अक्सर उस व्यक्ति को घर से बाहर निकाल दिया जाता है। तो इसलिए ये स्टिग्मा, डिस्क्रिमिनेशन इसके वजह से होता है क्योंकि मिसअंडरस्टैंडिंग है हमें HIV एड्स के बारे में। ट्रीटमेंट फॉर HIV इज ART. What does ART stand for? Anti Retroviral Therapy. It's a combination of medicine given to people living with HIV. और हमारे भारत में जे अस्पताल जो बंबई में है वहां से शुरू किया था, मेरे ख्याल से 2000 में शुरू हुआ था, 2001 में। तब HIV के जो केसेस बहुत बढ़ने लगे थे और स्टिग्मा, डिस्क्रिमिनेशन बहुत था तभी, क्योंकि लोगों को उतनी जानकारी नहीं थी। तभी मेडिकल प्रोफेशनल्स के साथ सोशल वर्क, एनजीओ सेक्टर ने आगे कदम उठाया और इस विषय पर काम करने लगे. It is because of medical fraternity, government, good-willed government, and the NGO sector, we were able to manage HIV. And there was this goal of zero infection, zero death, zero stigma. एक वर्ल्ड एड्स दिवस का एक थीम था. Let us all strive for zero infection, zero death, zero stigma. Today, can we say that have we reached that stage? No. Now they are saying at least 90%, 90 का एक फॉर्मूला बनाया है जो बोलते हैं कि 90% जिसमें HIV है, 90% लोगों को मालूम होना चाहिए कि मैं HIV बाधित हूँ. क्या पता आप में और मेरे में भी HIV वायरस है, और कैसा पता चलेगा मेरे में है कि नहीं? अगर मैं क्विज में क्वेश्चन पूछूं तो जरूर आप लोग आंसर दोगे. कैसा पता चलेगा कि मैं HIV पॉजिटिव हूँ या नहीं? By blood test. Only with blood test a person will come to know whether there is HIV virus in that person or not. किसी के चेहरे के देखने से, उनके शरीर को देखने से कोई नहीं कह सकता कि अरे ये तो HIV बाधित व्यक्ति है. वो गलती हमें कभी नहीं करनी चाहिए. तो HIV, ये जो एंटी रेट्रोवायरल थेरेपी है, ये HIV बाधित व्यक्तियों को दिया जाता है ताकि उनका जो स्प्रेड ऑफ HIV जो शरीर में है ना, वो कंट्रोल करते हैं, उसको नष्ट करते हैं, पूरी वो मिनिमाइज करते हैं स्प्रेड को. उसके स्प्रेड को कम करने से पर्सन हेल्दी रह सकता है और अच्छा जिंदगी, नॉर्मल जिंदगी जी सकते हैं. हमने देखा है चिराग में काम करते समय जे अस्पताल में बहुत ही एंड स्टेज पे किसी को लेके आते थे एड्स के व्यक्ति को, और डॉक्टर खुद हाथ ऊपर कर देते थे, बोलते कि ये नहीं, इसका कुछ नहीं हो सकता है, वी कांट डू एनीथिंग. तब मैंने खुद ने देखा है कि कैसे केयर एंड सपोर्ट के साथ, इन पेशेंट्स के साथ जब हम काम करते हैं. मेरे सोशल वर्कर्स, चिराग के सोशल वर्कर्स बहुत बढ़िया काम करते थे हॉस्पिटल्स में, स्पेशली जे हॉस्पिटल, सायन हॉस्पिटल, यहाँ सब जाकर उन्होंने खुद पेशेंट्स के साथ रह के उनको सहारा दिया, फैमिली को समझाया, काउंसलिंग किया, और डॉक्टर्स खुद आश्चर्य हो जाते थे कि 8-10 दिन में ये व्यक्ति कैसे ऊपर उठ के बैठ गया. बहुत सारे पेशेंट्स है HIV के, उनको डॉक्टर लोग ने वो मरने के पहले बोल दिए कि ये खलास हो गया, डेथ सर्टिफिकेट बनाने को चले जाओ, ऐसे बोलते थे. लेकिन सही केयर एंड सपोर्ट के साथ हम इनको उठा सकते हैं. गुड न्यूट्रिशन, गुड मेडिसिन इन टाइम, काउंसलिंग एंड द फैमिली सपोर्ट, ऑल दिस गोes along to help HIV infected people. There is no cure, but there are medicines that can help in the treatment so that the viral load in the body comes down. तो इसलिए एक है कि CD4 टेस्ट होता है कि देखने के लिए कि आपका जो शरीर में जो रोग प्रतिकार शक्ति कितना मजबूत है, वो देखने के लिए CD4 काउंट होता है. और अभी आजकल तो वायरल लोड टेस्टिंग शुरू हो गया है सभी जगह. वो देखते हैं कि कितना वायरस का लोड कितना है शरीर में, ज्यादा है, कम है, तो वो हिसाब से उनका ट्रीटमेंट होता है. HIV में भी वो लेवल्स होते हैं, फर्स्ट लाइन ट्रीटमेंट, सेकेंड लाइन, थर्ड लाइन, फोर्थ लाइन, वो वायरल लोड के अनुसार उनको ट्रीटमेंट दिया जाता है. और आज की तारीख में बहुत अच्छा प्रोग्रेस किए हैं हमने. लेकिन मुझे दुख ये बात होता है कि हमारे गवर्नमेंट पीछे हट गए हैं. तो इसके लिए अभी भी हम देखते हैं, आपने वो स्टेटिस्टिक्स में देखा है, आपने देखा कि अभी भी कितने लोग गुजर गए हैं. मेरे ख्याल से मैंने आज का डेटा देखा था, कहीं बताते हैं कि some 60,000 or some few thousands of people with AIDS when they really don't have to, because I witnessed seeing many patients who have lived even 20 years, 25 years, 30 years after being infected. तो मैं ये बताने की कोशिश कर रही हूँ, किसी को घबराने की जरूरत नहीं है. कोरोना हुआ तो क्या, कोरोना से भी कितने जन डराते हैं हमको, कोरोना से भी ज्यादा तो डर से लोग मर जाते हैं. हाँ, तो इसलिए HIV, even cancer today, so many people are living survivors of cancer. But there was a time when people will not even like to tell people, oh, so and so has got cancer, so and got HIV. We need not fear. Our role and attitude. अभी समझो हमारे नेबरहुड में या मेरे ही फैमिली में अगर किसी को HIV हुआ तो मेरी क्या भूमिका होनी चाहिए, मेरा क्या एटीट्यूड होना चाहिए. Need to make a conscious effort to develop an attitude of respect towards our people and be sensitive to their feelings and belief. अक्सर कहा जाता है, अगर सब जो डॉक्टर, स्पेशली हम लोग डॉक्टर से बहुत ताल्लुक रखते थे जे हॉस्पिटल में और दूसरे हॉस्पिटल में भी, कभी कभी ना डॉक्टर्स जो नॉट इनसेंसिटिव होते हैं ना, अगर वो जब मिलते हैं HIV पेशेंट्स को पूछते हैं कैसे हुआ, बहुत साल पहले की बात है जब सेंसिटिविटी ज्यादा नहीं था, कैसे हुआ. सुनो, HIV कैसे हुआ जानने की किसी को जरूरत नहीं. HIV कैसे तुम्हारे शरीर में आए जानने की किसी को जरूरत नहीं. क्या जरूरत है? लोगों को रिस्पेक्ट करना, उनको देखना कि उनको अगर मेडिकल हेल्प चाहिए तो वो देना, साइको सोशल सपोर्ट चाहिए वो देना, उनकी फैमिली को कुछ हेल्प चाहिए वो देना. ओके, दैट इज मोर इम्पोर्टेंट. वी डोंट हैव टू स्पेक्यूलेट, अरे हाउ दिस पर्सन मस्ट हैव गॉट HIV. वी डोंट हैव टू बॉदर अबाउट दैट. नेक्स्ट. सो वी शुड नॉट डिस्क्रिमिनेट. फैमिली में सोशल फिजिकल रिस्ट्रिक्शंस, हमें डिस्क्रिमिनेट नहीं करना है. ओके, फॉर HIV हम कैसे संभाल सकते हैं? एंड टू देयर इज नो क्योर, आई सेड, but definitely we can prevent being infected by HIV. How do we prevent ourselves? Becoming educated about HIV and understanding how it is transmitted, and it is important to prevent the spread of HIV. Abstaining from sex and needle sharing is the most effective way for people to protect themselves from HIV and other sexually transmitted disease. Abstaining from sex and needle sharing. क्योंकि हमने देखा है कि फ्लूइड्स और ब्लड से ही वो ट्रांसमिट होता है. तो जो भी कार्य में फ्लूइड्स का ट्रांसमिशन होता है, हमें वो उससे हमें संभाल के रहना है, दूर रहना है. प्रिवेंशन ऑफ सेक्सुअल ट्रांसमिशन में एक सूत्र दिया गया है ABC का. ये ABC का सूत्र क्या है? शायद आप लोगों में कुछ लोग मेरे से एग्री नहीं करोगे, लेकिन यही है बात. यू वांट टू प्रिवेंट योरसेल्फ फ्रॉम HIV. वन इज एब्स्टिनेंस. एब्स्टिनेंस को यानी you don't get into sexual activity, you're abstaining from sexual activity, sure you cannot be affected by HIV, infected by HIV through sexual transmission. Secondly, being faithful to a partner. Sexual transmission with one partner will ensure that you do not get infection from anybody else, and your partner also should be faithful to you. It's not that only often if it is expected the woman should be faithful. What about the man? Okay, the man also has to be faithful to one partner. That will prevent sexual transmission of HIV. Then consistent use of condoms. Suppose a person is HIV positive, maybe either they have got from their parents or from blood transfusion during an accident or surgery. What do they do? They also should not transmit their virus to another. So therefore, consistent use of condoms during sexual activity will help them. Next. What do HIV/AIDS or patients need? Can we help? Okay. In Chirag, this is the logo of Chirag, which we had, and in Chirag we were all helping HIV patients. What is it needed? And that is the most important thing. See how it is spread, why it is spread, how many people, all this data you will get in Google and internet, you can find out. But this I would like to highlight. What is the kind of help we need to give people who are suffering from HIV/AIDS? First, psychosocial counseling and palliative care for AIDS patients admitted in the hospital. As I already told you the example, in the hospitals, the state, in many hospitals, and let me tell you, they keep them in one corner. Not sufficient care is given to them. Such patients need psychosocial counseling and palliative care besides medicines and nutritional support. Pre-treatment counseling and assistance at ART centers. Many people get scared to even test themselves for HIV. That is the very sad thing. One should get tested, and for testing HIV, there are strict protocols which usually centers adhere to. For example, test की करने के पहले counseling होता है. In government centers, you go for HIV test, they'll first send you for a counseling. पूछेंगे आपको क्यों करना है? Were you engaged in any high risk behavior? All this is happening. But when you go to private hospitals, before any surgery, whether you like it or not, HIV testing is compulsory. So therefore, nowadays what they say, use universal precautions. So you don't have to test anybody without counseling, particularly without the consent. HIV test करने के पहले किसी का consent लेना जरूरी है. फिर उनका टेस्ट किया जाता है. That is pre-treatment counseling and assistance at ART centers. The patient's adherence to treatment through home visit. अभी टेस्ट करने के बाद अभी समझो पॉजिटिव आ गया, तो पॉजिटिव का आप कैसे खबर दोगे? मैंने देखा है खुद अपनी आंखों से जेजे हॉस्पिटल में 2000 में मैं फील्ड वर्क कर रही थी, MSW करते समय. तब मैं देख रही थी कि 200-300 लोग आ जाते थे और वहां के जो स्टाफ थे ना, एक बक्से में उनके रिपोर्ट्स रहते थे. वो एक एक को बुलाते थे. ए तुकाराम गे पॉजिटिव, ए शिंदे गे नेगेटिव, असलम नेगेटिव, ऐसे जैसे कि बांट रहे थे पेपर. पॉजिटिव नेगेटिव ऐसे चिल्ला के बोल रहे थे. Oh my God, that was really terrible. लेकिन अब ऐसा नहीं होता है. सब बहुत लोगों ने काम किया है, बहुत लोगों ने काम किया इस फील्ड में, और अब ऐसा नहीं होता है. अभी प्राइवेटली उनको बुलाते हैं, अपने कमरे में काउंसलिंग रूम में बुलाते हैं, फिर बताते हैं रिपोर्ट, बताते हैं. पहले बताने के पहले पूछते हैं आप कोई हाई रिस्क बिहेवियर में थे क्या है, आपके कोई सिम्टम्स है. फिर in a very healthy way they tell them that the person is positive and what they need to do. Positive doesn't mean that it is the end of life, no. And then उसका CD4 मेजर करते हैं, देखते हैं कि उसको अभी ट्रीटमेंट चालू करना चाहिए या नहीं. पहले तो सिर्फ CD4 काउंट देखते थे, फिर बाद में देखते थे, फिर चालू करते थे ट्रीटमेंट. लेकिन अभी WHO UNAIDS का प्रोटोकॉल है कि नहीं, कुछ कंट्रीज में तो जैसे ही पॉजिटिव है वो उनको ART में चालू कर देते हैं ताकि वो और लंबी आयु जिए और स्वस्थ आयु जिए. ऐसे होता है. देन अंडरटेकिंग होम विजिट्स. एक है जब दवा चालू होता है तो ये मॉनिटर करना बहुत जरूरी है कि पेशेंट्स दवाई ले रहे हैं या नहीं. इसके लिए होम विजिट्स भी होता है. मैं जब काम करती थी शायद किसी पेशेंट ने मेरा नंबर दे दिया होगा मुझे. यहाँ अभी मैं दिल्ली में हूँ, मुझे दिल्ली में भी कभी कभी फोन कॉल आता है सायन हॉस्पिटल से या कुछ और हॉस्पिटल से कि मैडम सो एंड सो है क्या आपके साथ. मैं बोली नहीं है, मैं तो दिल्ली में हूँ. बोले नहीं, मुझे हमें पूछना था वो दवाई ले रहे कि नहीं HIV का. देखो, I was very happy that they are showing concern. The patients that are in the list, are they taking medicines or not? They phone and they find out. Next, undertaking home visits. Also, if necessary, we have to do home visits of ART defaulters towards their retrieval for treatment. But this is also not easy because जो लोग HIV treatment के लिए आते हैं ना, अक्सर लोग गलत नाम देंगे, उनके गलत एड्रेस देंगे. क्यों? उनको डर लगता है कहीं ये लोग मेरे घर पे आ जाएंगे और मेरे घर वालों को पता चल गया कि मैं HIV हूँ तो मुसीबत खड़ी हो जाएगी. तो लोग छुपाने की कोशिश करते हैं. और छुपाते क्यों है? क्योंकि हमारे समाज में हमने इतना बड़ा उसका ये बना दिया ना कि स्टिग्मा, गलत है, शीशी, HIV, अरे बाप रे, ये सब कर दिया. इसके लिए लोग घबराते हैं. अगर हम खुलेआम से HIV एड्स लोगों का हम उनको अपनाएंगे, उनकी सेवा करेंगे तो लोग घबराएंगे नहीं बोलने के लिए. जब लोग घबराएंगे नहीं तो वो आराम से वो ये करेंगे. नेक्स्ट. हाँ, ठीक है. I think I will share the PPT to the group. Anybody is more interested can read it. I think just 1 or 2 slides will be there. Emotional support is important. Enhancing community participation. That is last. I'm coming to the questions. Enhancing community participation towards caring and supporting the PLHA. And lastly, intervening in the lives of the patients who are discriminated in the workplace, taking up their cases and helping them to rejoin the work if they are medically fit. ये केसेस बहुत सारे हैं हमारे जो सोशल वर्कर्स ने काम किया, जैसे कि वो लोग घर में बैठ जाते हैं, काम पे नहीं जाते, तो उनको डर लगता है कि काम पे लोग मुझे पहचान लेंगे कि मैं HIV पॉजिटिव हूँ। ऐसे आर्मी का भी एक बंदा था, 2 साल वो काम पे नहीं गया, फिर उसको सैलरी भी नहीं मिल रही थी। फिर बाद में हमने जाके आर्मी ऑफिसर को बोला कि नहीं, इसको ऐसा है प्रॉब्लम, जरा आप उसको फिर से बुला लीजिए। एंड दे वर वेरी गुड when the employers, when they come to know, when they put across things correctly, and they take them back to work. And this is all very, very important. These are the areas. So HIV AIDS is not just a medical illness. It has lot of psychosocial ramification, which I think not only the doctors, nurses cannot do. It needs a multidisciplinary approach where the medical team, the government, the social workers, and so many people, the family, the school, the teachers, neighborhood, all have to work in a united way, and that is what we call community-based care and support for people living with HIV. और ये हमने शुरू किया था चिराग में, that came up after the जो चिराग था फील्ड वर्क प्रोजेक्ट था कॉलेज ऑफ सोशल वर्क निर्मला निकेतन का, 2004 में हमने इंटरनेशनल कॉन्फ्रेंस रखा था और उसके बाद चिराग आया, क्योंकि हमने देखा अगर सही कम्युनिटी बेस्ड केयर एंड सपोर्ट होता है HIV पेशेंट्स के लिए तो वो अच्छी जिंदगी जी सकते हैं, लंबी आयु का मजा ले सकते हैं और सब काम करके आराम से जी सकते हैं, अच्छा फैमिली में रह सकते हैं। थैंक यू। एनी क्वेश्चंस? लेट मी नो। सॉरी इफ आई हैव टेकन मोर टाइम। Sorry. Hello?
Ma'am.
Yes, any questions?
Is there any government scheme for the patient?
Is there any government? I didn't get you a little louder.
Yeah, scheme for the patient, for their financial support or for their educational support or for their business related support.
Yeah, financial support, educational support. I'm not aware whether government any schemes are there to help, but many NGOs, many NGOs work for HIV people, HIV/AIDS people, and they help. Like we ourselves in Chirag, we supported many families for their children's education, nutritional support, and the like. And yes, NACO used to support some NGOs to run this program. And through that, one may say that, okay, government support was there, but it is only through NACO, and the various states have their own AIDS control societies in different places, like MSACs, MDACs, and different states they are. So they have a minimum budget to help, but I would say more help comes from NGO sector. Unfortunately, our NGO sector is, you know what is happening to NGO sector now. Okay. I hope I have answered your question. Any other question? I have also.
Yes, ma'am. Thank you.
Okay. You can see the helpline, AIDS helpline. This I took from NACO, National AIDS Control Society. 1097 is the AIDS helpline, I suppose, toll-free number. Anyone who needs more information can call this number, and also in case you want some clarification, some help, I'm available to you on my email or phone number. You can take down, I have shared it.
Hello.
Hello, ma'am.
Yes, yes.
I had a question.
Yes, yes.
Red areas are looked down upon because they are already looked down upon socially, but red light areas are more prone to AIDS, HIV/AIDS. So when it comes to them, they are tend to be treated more pathetically by the society. So aren't there NGOs which are working especially towards treatment of HIV/AIDS for the people who are currently in those sectors?
Very good concern you have pointed out. Yes, you are right. People who are engaged in sexual activity, like sex workers, okay, they are in that activity and they are called high risk behavior, people with high risk. And therefore, many NGOs reach out to them, giving them more awareness what is HIV. And today many of them are aware, but as I say, you cannot stop. You can never say that now everybody knows HIV AIDS, now we can pack our bag and close our shop. No. What about more and more entering the youth, the children, when they grow older, they get into sexual activity. Very times people ask, एक बार सेक्स करने से हो जाता है क्या HIV? It's like asking, एक बार सेक्स करने से प्रेग्नेंट हो सकती हूँ क्या मैं? These are the kind of questions that come to us. हो सकता है, तो हमें संभाल के रहना है. हमें ये देखना है कि हमारा जो एक्टिविटी हम एंगेज कर रहे हैं, it should be a responsible activity. Who is this person? Even sex workers, for them it is their livelihood. But sex workers are given free condoms, they've given information, and many of them demand that their partners use condom before sexual activity. It's happening, but more work has to be done in this area.
All right, ma'am. Thank you so much. One last doubt. Pregnant ladies, if they are diagnosed with HIV/AIDS, are they allowed to, like abort their kids or something like that?
Very interesting question. What do you say? Let me ask you. Should they abort? Do you think so? If a woman is HIV positive, should she abort if she comes to know she's pregnant?
As much as I have known, it is considered to be a very big of a deal when it comes to religious issues, aborting and stuff like that. And maybe if it's HIV, because of HIV, you want to abort and all those things, then it will be a major chaos. So I don't know the answer for this, but I certainly think the lady will be pressured not to abort because it's her fault. So
her fault. Okay, I see. Here, I just want to say, first of all, hats off to many of the doctors and scientists working in the field of HIV. I know that in JJ also big efforts were made, and today there is a very good success in children born of HIV mothers. They are not positive, they become negative. Many children born of HIV mothers need not necessarily be positive. Why? Because they are treated in time. There is treatment available during, I think, I'm not a medical person, I'm more a social worker, but as much as I know, during one of the trimester, I suppose it is third trimester, they use an injection or a tablet, they give a medicine to the mother, and with that medicine, that transmission to the child becomes very, very minimum. So much so that there are cases, children born of HIV not positive. Should that mother should have gone ahead for abortion? She would have lost this child, no?
Not at all. Not at all.
And also there is a question of whose right. The child has a right to life. Mother has a right to what? Whatever, I don't know. What about the child's right to life? No? Okay, it's something like same, no? A child is, you come to know today through diagnostic test, the child is not okay. He has no limbs, eyes, he's blind, he's physically challenged, mentally challenged. Today people come to know beforehand. In that case, we should abort all these children. There will not no physical challenge, no disability, no mental challenge, right? We need to think in a broader perspective. And also, it's a connected question I need to ask. Should HIV people have the right to marry? Can they marry? Think about it. Do they have right to marry? These are the things we need to ask. And y'all are many youngsters who are watching this. So I want to tell you, I hope all the youngsters should demand a HIV test from their partners before marriage. Like कुंडली तुम लोग मिक्स ये करते ना, चेक करते हैं ना कुंडली जमता है कि नहीं, तो HIV रिपोर्ट भी ले लो साथ में. हाँ, हम पगार का पूछते हैं, प्रॉपर्टी पूछते हैं, वैसे ही देखो कि उनका HIV टेस्टिंग भी करने को बोलो. नहीं, ये नहीं करेंगे, ये नहीं करेंगे हमारी लड़कियां. हमारे बोले लड़कों वो क्या सोचेंगे कि वी आर नॉट ट्रस्टिंग देम. लेट देम ट्रस्ट. It has to be made mandatory. I hope marriages where like churches में जो solemnize करते हैं मैरिज, मंदिर में जो होता है, कोर्ट में होता है, मैं चाहूंगी सचमुच कि एक लॉ बना दिया जाए कि शादी तुम्हारा तब हो सकता है जब तुम आप दोनों जन HIV रिपोर्ट एक दूसरे को बताओगे, तब जाके हम लोग अच्छी तरह से प्रिवेंशन कर पाएंगे. वो तो एक है. So this is by and by. So again, we have to give right to the child. It's not only religion, I'm talking about medical. Medicine has advanced. So let us trust in the medicine and go ahead. Okay, thank you. Any other question?
Yes, participants, please ask the question if you have any questions. Ma'am is there to guidance you.
किसी ने HIV एड्स पेशेंट्स को देखा है, मिले हैं, बात किए हैं, मदद किया है किसी को? है अपने मेरे ऑडियंस में कोई है? कुछ शेयर करना चाहेंगे आप?
No, ma'am, because as far as we've been in this society, we were taught morally we were taught that it is wrong. Education wise, we were taught that it is okay, it is common. But when it comes to moral teachings, we were taught that these things are wrong, these things are taboo. So,
hello, I'm not saying. See, you are saying morally it is wrong. What is wrong? And
no,
what is right? What are we talking about?
It's not me talking. I am telling you what I have been hearing from my elders. I have a broad perspective.
I think I have not understood you, Dinah. Can you repeat? What have you heard from them?
You asked us that whether we have been in contact, like whether we have approached such people who were AIDS positive, etc. But our church elders, not church elders, our elders and all, they have taught us that such people are not someone you should approach to, because it is not good. What they have done is bad, etc., etc. We know that it is not. ऐसा सीन नहीं है, we know that, but what we were taught, we were told to be away from such people. So that was the answer to your question, which you asked whether you all have approached people or not. That is what I was saying.
Thank you, Dinah, for your very frank sharing. I really appreciate that. I'm really sorry that you heard such a thing from church people saying that, you know, they are all bad people, we should not go. This is very, very wrong, I would say. Sorry, Hindi में, English में, very, very sad, because Jesus ने क्या किया? उनका उदाहरण ले लो. उन्होंने क्या किया? जो लेप्रेसी थे, कोई हाथ नहीं लगाते थे, सब दूर चले जाते थे, लेकिन उन्होंने जाए, टच किया. Adulterous woman, adultery is also very bad, na? Very sinful. Sin is, don't sin, but don't hate the sinner. Understand? I'm not saying that we should, I'm not promoting here unprotected sex or be careful. I'm not saying all of us must use condoms. I'm not saying that. I'm saying, what is HIV AIDS? Try to understand the disease, understand the people who are suffering. Why are they suffering? Can we reach out to them? Okay? Thank you, Dinah.
Any other question?
I can talk more and more, but I know time is very limited. But it is, I'm full of passion, you know. I feel this is an area which really needs, and people don't talk. Our parents don't tell us about this. And therefore, my dear friends, I would like you to read more about it, share with people, and help people. Okay.
Hello,
Yes.
Sachin Urade here, ma'am.
Sachin, hi. Yes. Thank you
You were
very much,
asking that
Sachin. Yeah.
anyone those who have gone for HIV/AIDS patient contacted with them, work with
Hmm.
them. I work with them around 2 years, ma'am.
Wow,
Especially
very good.
international HIV patient,
Wow, wow.
Bangladesh, Dhaka. So in
Mm,
Rescue Foundation.
wonderful. Very good. Nice to
So
hear that.
I used to counsel them on different issues. But I have
Thank you.
seen patient almost before 15 years, means 15 years age group to 13 years age group.
Mm,
And because of trafficking and other issues
mm,
and misguided by the boyfriend and other pimps. So it was horrible experience and good learning gain for me also.
mm.
But obviously it was a great experience and now they are repatriated to different states of India and they are doing their well.
Mm-hmm. Very good. You may be
Mm.
better in a position to compare what is happening in India and other countries also, na?
Yes,
Yeah.
yes. And Aishwarya Bangale, our NSS volunteer, please give vote of thanks.
Thank you, Sachin, for giving me this opportunity. Yeah. Thank you so much.
It is our pleasure, ma'am.
It is our pleasure, ma'am.
Good evening, everyone. I am Aishwarya Bharale, and I am here to present the vote of thanks for today's HIV/AIDS awareness program. I would like to thank our chief guest program speaker, Dr. Anita Chapter, enlightening us with their knowledge. Today's program was full of knowledge and interesting facts. I am pretty sure the precious knowledge that Dr. Anita Chettar gave us will definitely help us in our future. Once again, I would like to thank Dr. Anita Chettar for taking out time from her busy schedule and enlightening us with the knowledge. Thank you so much, ma'am. I would also like to thank our Elder Education Trust management for giving us permission to conduct the event. Also like to thank principal of all institutes, technical coordinators, student coordinators, faculty and NSS program officers of various institutes of St. John Technical and Educational Campus. Also, I want to thank the NSS committee who really work hard to make this event successful. Also, thank you to all the students present here for paying your attention and learning. I would end my speech here. Thank you.
You're most
Over
welcome.
to you,
Yeah.
Shraddha Miss.
Most welcome to ask more questions personally, by email or WhatsApp. Thank you.
Thank
Yes,
you.
ma'am,
Thank you
sure.
for this wonderful session.
Yeah. Now I request all the participants kindly on your camera. We'll take one group photo. Kindly on your camera, all the participants. इथे या ना आले Okay, thank you so much.
Thank you, ma'am.
Thank you all the participant and all the coordinator. Very thank you for this wonderful session.
Yeah. Please kindly fill the feedback which is posted on the groups as well as here in the chat box. Thank you so much, all the participants. You may leave the meeting now.
Thank you.
Thank you, ma'am.
Hello, Sachin. Hello. Sachin is here. Sachin, Mary
ma'am.
Colasso, you know.